the health of our people.
A tax like this is important to help to curb the rates of non-communicable diseases. As we all know, or maybe we don't all know, but sugary drinks are one of the risk factors for a number of non-communicable diseases such as diabetes, some cancers, obesity as well. That's also a risk factor for diabetes.
We will do everything possible to ensure that Nigerians get benefits as regarding their health. So above even increasing the amount per litre, it is also important that we let Nigerians know the adverse effect of sugar and all other things that they consume to their health.
Hi, I'm Adenike Adebayo. SSB tax save lives.
Consumption of SSB is not a sign of affluence. It is the fastest way to ruin your child's future. I'm calling on to parents to reduce the consumption of SSBs and embrace water and other healthier alternatives. My name is Daniel Ibikiton. I support the SSB tax.
Hey, my name is Tolu Aishefagbenja. I'm calling on Nigerian government to increase SSB tax now.
As a sport person, I understand the dangers of SSB. I hereby call upon our government to increase SSB tax. My name is Olalikon Daramola.
SSB predisposes consumers to NCDs. My name is Blessing Olatunjoye, and I'm telling the Nigerian government to increase SSB tax now.
I'm Banji Akole. I'm a youth advocate, and I believe that government must implement healthy food policy, and the time is now.
My name is Salami Oluwadamilola. SSB tax saves lives. I call for the increase of SSB tax now.
The consumption of SSB has ripple effect on our environment and climate change, right from the production, the packaging, and the consumption of SSB products. I call on governments to put effective policies on healthy food.
Increase SSB tax now!
Good evening, everyone. My name is Suwaidat Inama Ahmed. I work with Federal Ministry of Health. I'm the Chief Health Education Officer. Today is World Diabetes Day and the stand of SSB tax. I just want to let you know that diabetes is real. This is caused by excess sugar, which we have to limit from taking so much sugar so that you can have your healthy life. Now, I am in support of SSB tax, and the government should also rely with them so that we can also work with them and make diabetes a free thing to many people in Nigeria by stopping excess sugar in your intakes. Thank you.
Greater exposure to ultra-processed foods was associated with a higher risk of adverse health outcomes. Different kinds of sugar, ultra-processed foods. One of that is the sugar-sweetened beverages. So why are we focusing on SSB? It's an ultra-processed food, and it's been known to have significantly greater health risk. If you are taking sugar in some other food pattern, those will still contain some nutrients that you are getting. Unfortunately for SSB, it contains no nutritive value. It's just filled with high calories that the body does not need. Of course, we need sugar to do what we do. Sugar is changed to ATP, that is the energy that we are using. But the food we eat normally, the beans, not the yellow beans, the rice contains enough ATP, sugar that we need to survive.
Emeka.
Uncle, well done, sir.
You are counting money.
Yeah, yes.
That is finance. You're already practicing what I want to tell you. There's a program that is coming up on the 29th of this month, which is October 2024. This Tuesday that is coming now. Have you heard about it? It's Kappa something. Kappa will be organizing a program live at Abuja. is a national conference on SSB tax and healthcare financing in Nigeria. And this one, it comes with an hashtag SSB tax for health financing. So yeah, you have to be there, Emeka. This one will be happening at Abuja. And there are many people. In fact, look at my screen. You will see all the people that are going to be there and all the topics that they will be meeting. Remember, it's on the 29th of this month, which is this Tuesday, Emeka.
But Uncle, I don't have data. Maybe you will honor spot for me again.
You don't have data again? No problem. If you don't have data, that one is not an issue. The money in your hand, Uncle.
The money?
Bring it. Let me see first. Bring it. Give me that money.
This man!
At least this one now, I'll use it and buy data so I can honor spot for you. All right.
Children sugar, I won't lie to you. My children, they consume sugar. Even sometimes my daughter will even go to where we keep sugar and lick it. And I went home. What I gained here was a topic. I use it as a sermon to them.
I got home yesterday and I called my children and I said, my money will never go into any soft drink.
I got home yesterday. I called my family. And I said, look, it's got to stop. I must confess that I had this habit of taking Fearless. One habit I found difficult to overcome was taking Fearless. If I didn't hear what I heard yesterday, I probably would have taken it on my way home.
I have decided, I told them in my home, that Zobo sweetened with natural pineapple or nothing else.
To my house, we are reducing the SSB and...
From yesterday, I've tried to take conscious efforts to reduce my sugar intake.
Someone said something to me yesterday that scattered me yesterday. He said, with the way you are eating, are you sure you can get clock 80 years old?
Or more.
That thing, I got home, I had a meeting with my family.
Wow.
I was asking my children, can I be up to 80 years old with the sugar we are eating? He said, Daddy, I don't know. So I called my younger one on phone. I said, with the way we are eating sugar, because we eat sugar a lot. Are you sure you can be up to 80 years? He said, who preached this topic to you?
Personally, in my house, I do buy SSBs, and my mother consumes more of it, despite being, having high blood sugar and all that. So I would have to stop that.
I reshape my lifestyle, my household, the way what we are going to eat from now going on, what I'm going to eat personally, and what I'm going to write about.
My take home from here, of course, the effect of SSBs. I have a personal, story. Of course, my dad died from diabetes. It wasn't an easy journey. In fact, the 7 months in which he fell sick, critically ill, and was the longest 7 months of my life.
My name is Dr. Inwa Junedu. I'm the Director of Health Planning Research and Statistics with the Niger State Ministry of Primary Healthcare in Niger State. Today, I think I commemorate with everyone on today being marked as World Diabetic Day. And I think there's no time better than now to talk about sweetened sugar beverages. And we know that sweetened beverages
WHO advises that limiting the intake of sugar-containing drinks can help individuals maintain healthy weight and a healthy diet pattern. Nigeria is amongst the countries that contribute to 77% of the global 41 million deaths caused by NCDs. This has been established by the WHO and duly captured in Nigeria's roadmap to eliminating the scourge of NCDs. However, the federal government is very much committed to providing leadership for the implementation of SSB tax in our country. While we are also struggling with cutting down the menace of non-communicable diseases, we think that this is the time for us to put in more oil in our lantern in trying to reduce the burden of non-communicable disease in the country.
The tax reform that should be done relating to SSB tax public health is to have a sustainable law like other government that will ensure that SSB are taxed to that tipping point that will cause reduction in consumption and protect the health of our people.
A tax like this is important to help to curb the rates of are one of the risk factors for a number of non-communicable diseases such as diabetes, some cancers, obesity as well. That's also a risk factor for diabetes.
We will do everything possible to ensure that Nigerians get benefits as regarding their health. So above even increasing the amount per litre, it is also important that we let Nigerians know the adverse effect of sugar and all other things that they consume to their health.
Hi, I'm Adenike Adebayo. SSB tax save lives.
Consumption of SSB is not a sign of affluence. It is the fastest way to ruin your child's future. I'm calling on to parents to reduce the consumption of SSBs and embrace water and other healthier alternatives. My name is Daniel Ibiki-Itan. I support the SSB tax.
Hey, my name is Tolu Aishefa-Gbenja. I'm calling on Nigerian government to increase SSB tax now.
As a spokesperson, I understand the dangers of SSB. I hereby call upon our government to increase SSB tax. My name is Olalekan Daramola.
SSB predisposes consumers to NCDs. My name is Blessing Oladunjoye, and I'm telling the Nigerian government to increase SSB tax now.
I'm Banji Akole. I'm a youth advocate, and I believe that government must implement healthy food policy, and the time is now.
My name is Salami Oluwadamilola. SSB tax saves lives. I call for the increase of SSB tax now.
The consumption of SSB has ripple effect on our environment and climate change, right from the production, the packaging, and the consumption of SSB products. I call on governments to put effective policies on healthy food.
Increase SSB tax now.
Post on your social media platforms, use the hashtag, tag the Federal Ministry of Health, CAPA, and let's get the conversation going.
Aburú inú ẹ̀ pọ̀ jọjọ, kò sí àǹfààní kankan tó ń ṣe ní ara. Mo ń fi àsìkò yìí rawọ́ ẹ̀bẹ̀ sí ìjọba wa pé kán fi owó kún owó orí gbogbo àwọn ọtí ẹlẹ́rìndòdò fún ìlera gbogbo àwọn ará ìlú. Ẹ ṣé púpọ̀.
Orúkọ mi ni Ọláyẹmí Ṣọlá Babátúndé. Àwọn ọtí ẹlẹ́rìndòdò ó ń fa oríṣiríṣi àìsàn ní àgọ́ ara wa bíi àìsàn ọkàn, àìsàn ìtọ̀ ṣúgà àti ọ̀pọ̀lọpọ̀ ohun tó léwu ló ń fà ní àgọ́ ara. Mo ń fi àsìkò yìí rọwọ́ ẹ̀bẹ̀ sí ìjọba kí wọ́n fi owó orí kún àwọn ọtí ẹlẹ́rìndòdò yìí fún ìlera àwọn ará ìlú.
And also take lessons from it. Also, when you take your pictures, don't forget to tag us. Use the hashtag SSB tax for health financing. Ladies and gentlemen, please let us return to the room. We have 3 minutes to kickstart the next session. At this point, we need every one of us to be back in the room and seated. Our panelists are ready and raring to go. Thank you. The barcode on the screen can be scanned to get access to different MDAs. We also have legal representatives of select MDAs who are providing support for this campaign by looking at different legal arrangements available in the country. Thank you very much. Thank you to our friends, our supporters, advocates, partners. Dr. Ini, good to see you again, sir. Thank you, welcome. Dr. Francis, today, no worry, you know go sweat.
The moderator for the very first panel. The first panel is the burden of NCDs in Nigeria and the imperative of innovative intervention.
The burden of NCDs in Nigeria and imperative of innovative interventions. We know NCDs have increasingly become a significant public health issue. The this morning, the Federal Ministry of Health. Please put hands together for him. Thank you so much. So we will be going into the individual presentations. IT, please, are you with me? Okay. The last 2 minutes is for you to give your panelists. So you take the podium from me, and it will be projected behind you for everyone to see. Is that okay? Thank you, sir.
Thank you. To stand on the existing protocol. When 15 minutes comes to 10 minutes, you know I have to skip some things. I consider it a privilege, definitely, to talk about non-communicable diseases, the looming public health epidemic. The truth is, most people here probably know more about this than myself. A lot of people have heard this many times. I think I'm just basically to project the problem again as a reminder. While eminent personalities here, I've had the opportunity of people still argue with me. But now that you have said it, I think you have laid that to rest.